It's been called the most severe health emergency of modern times, Ebola's march of death, ravaging West Africa, spreading to Europe and the U.S., the worst Ebola outbreak in history, triggering panic and fear around the globe, including here at home. Are we ready? I'm Faith Goldie, and this is our special broadcast, Ebola Global Hot Zone. Well, folks, you've heard them. Both the CDC and the White House say nothing to see here when it comes to Ebola. No need to stop those incoming flights from West Africa. We'll just ask passengers if they feel like they have Ebola after they land. Oh, and those 70 healthcare workers and 100 other people who had contact with now deceased U.S. patient zero, no need to keep them in isolation. Then, see, we just be overreacting. Never mind the 21-day quarantine period after being exposed to the virus. Family members and pets in the homes, better we just send them all packing with a thermometer and trust that they'll monitor the symptoms. Yeah, it's no wonder the number of Ebola cases are on the rise, not just in Africa, but here in North America. And victims of the virus, well, they aren't the only thing that's growing. Canadians' concern about the deadly outbreak is as well. A recent poll indicates 79% of Canadians are concerned the ugly virus will turn up on our soil. 8 in 10 Canadians understand the real threat this outbreak poses to our country. And make no mistake, the threat is real. Health officials predict as many as 1.5 million people could be infected by mid-January. And at its current mortality rate, that translates to over 900,000 dead, on top of the thousands already buried by the bug. With a vaccine still several months away, the UN's Ebola chief, well, he's giving the world a doomsday warning, raising the nightmare prospect that the virus could mutate and become airborne. Over the next hour, we delve into the dark world of Ebola. We speak to leading experts on the subject and hear from folks just back from the Ebola hot zone with first-hand reports on the dire situation there. It's all coming up, but first, a primer on what the world is now facing. It's the deadliest outbreak of one of the world's most lethal viruses in human history. The nightmare of Ebola unleashed. A modern plague, a soaring toll of dead and dying. More than 4,000 people dead in West Africa. Thousands more infected with the fast-spreading disease. And it's spreading out of control. An outbreak so bad, a virus so deadly, some World Health experts now sounding the alarm. This could be the new AIDS. So, what exactly is Ebola? Ebola causes viral hemorrhagic fever where victims die from internal bleeding. Their insides literally turn to mush, often bleeding through their eyes, ears, nose, and elsewhere. From the jungle, the Ebola virus is believed to have first mutated to humans from infected animals, including fruit bats and chimpanzees. It was named after the Ebola River in the Congo, where the original outbreak occurred in 1976. There were 5 strains of Ebola, and there have been previous outbreaks, but none on the scale of this one, which was first detected in West African nation of Guinea in March. Once a person is infected, they can start to spread it from person to person. It is extremely contagious and spreads through direct contact with infected bodily fluids, including blood, vomit, feces, even contaminated environments. The most microscopic amount of bodily fluids is all it takes to infect other people. Victims first complain of fever, headaches. Often there's redness in the eyes and rashes, followed by extreme fatigue, abdominal pain. Then internal and external bleeding. Symptoms can appear up to 3 weeks after exposure. The mortality rate is between 70 and 90% of those infected. There are no specific treatments and no cure, though some new experimental drugs appear to show some promise. Though it is very early on, and these drugs, including one made by Vancouver company Techmira, are still in the testing stages. Many reasons. In the Ebola hot zone in West Africa, poverty, poor sanitation, population density, lack of decent health care, and cultural traditions all contribute. It's common for victims' families to wash the dead bodies, which spreads the disease.
As unknowing victims travel to other towns and cities, Ebola can spread like wildfire within West Africa and, as we're seeing now, to Europe and North America from infected travelers. Some grim predictions. The worst-case scenario has up to 1.5 million people infected with the deadly disease by January.
Many are now afraid that there soon will be nowhere to hide from Ebola. By the end of the year, health officials are expecting as many as 10,000 new cases a week. Jason Tetreault is a microbiologist with more than a quarter-century of expertise under his belt. He's an expert in germ studies and how they spread. He joins me now. Now, Jason, that's impressive, over a quarter-century under your belt. When we think about the hot zone, the hell that is being the epicenter of that hell, we think about 3 nations specifically: Sierra Leone, Guinea, Liberia. But it's spreading now. It's gone across the Atlantic. And since August, we're seeing exponential death rate climb. This isn't really showing any signs of slowing down, is it?
No. And, you know, when you look at something like an outbreak or an epidemic, I like to look at it as being something like a breach of a container. And so if you have a container that has a leak, a lot of people are figuring, oh, if we just patch the leak, everything's going to be fine. But no, that whole container is really your problem. And right now, those 3 countries are a container. So until we get in there and we take care of the entire Ebola problem, we are going to have not only the exponential growth, we're going to have the spread. And as we've seen, we're going to actually see the gaps that are in other countries. You know, what America has done, obviously they didn't learn from us, from SARS, and now they're paying the price.
Now, I want to draw our viewers' attention to a few concerning points here. First of all, 2012, there was a Canadian study that basically showed that Ebola could be airborne between pigs and primates. I want to draw up a quote board here, and this is from one scientist, Dr. Michael Osterholm. He's director for the Center for Infectious Diseases Research Policy at the University of Minnesota. Here's what he has to say. It is the single greatest concern I've ever had in my 40-year public health career. I can't imagine anything in my career, and that includes HIV, that would be more devastating to the world than respiratory transmissible Ebola virus. What he's saying there basically is that an airborne Ebola is the scariest thing that could ever face human history. Do you agree with that?
It's a case of fantasy football. Because when you look at the concept of airborne, everybody talks about mutation, evolution, genetics. But at the end of the day, it's physics. An airborne particle can only contain so much virus. And if you can't get infected from that airborne particle because there's not enough virus in it to cause infection, then why are we worrying? And that's really the case at this point. If it's in a droplet, there's enough for you to cause infection, about 1,000, okay? But if it's in that dry airborne particle that Osterholm is really concerned about, there's really nothing to worry about. And you can't expect the virus to evolve so that it's thicker and bigger and have more. It just doesn't happen. Physics will not allow it. So the concept of airborne is really something that, while, you know, in fantasy football, you're always looking at the what if, but in reality, especially with the panic that's going on, it's not worth talking about.
Now, you do bring up a good point, though, because it can be transmitted through these aerosol droplets.
Absolutely.
So a sneeze, kind of a wet cough, if you will. You know, we in the media have often, or are at least, comparing this to the new AIDS, but it is much more contagious, isn't it?
Yeah, it's a little bit more contagious than HIV because HIV is just blood, right? But when you're looking at Ebola, you're looking at any bodily fluids that can happen. And so it's in its own category, if you will. What you kind of have to realize, though, is when you are infected with Ebola, the only way that you're really shedding is through vomiting, through diarrhea, and the occasional weak cough. If you look at all the studies and all the people who have been in the Ebola-affected regions, there's no sneezing. It's just too hard. It just doesn't happen. So really, it comes down to cough. Now, if you're within that 3 to 6 feet, right, you're at contact. And you should not assume that you're not potentially at risk. And so the fact is, you know, for the healthcare workers, for the loved ones, and for those who are interacting in close contact, they have to be monitoring. You have to be realistic about this.
Now, speaking of being realistic about it, let's be realistic about the fact that we've got a lot of sinister groups and organizations around the world right now, up to all sorts of evils. What does the future look like if one of these groups or even individuals gets a hold of the Ebola virus and uses it basically for biological terror?
Actually, they're all going to die first. That's really the case. The military in the United States, they do a wonderful thing. They start looking at these ideas, and then they start testing them with monkeys and other animals. And what they found is that Ebola makes a very poor bioterrorism pathogen. That's why they choose anthrax instead, or some of the others. The problem is that when Ebola is around, people get infected. And in order for you to be able to get somebody to be, your suicide Ebolaist, if you will, the other people are going to have to come into contact, and they eventually are going to pass away as a result. So if you want to wipe out your terrorist organization while you're creating a bioterroristic weapon, then feel free to go ahead. Otherwise, there's really no point.
In that way, I'd encourage them to do it. But on the same note, on the same note, I have to say, if Thomas E. Duncan came over here with the infection and just, if he was a terrorist instead of just a well-meaning Liberian, we could have been in some trouble. Jason, we're going to have to leave it there. Frightening indeed. Lots more in our special broadcast, including Canada on Guard. We're going to look at how this country is safeguarding against Ebola coming to our country, but will it be enough? All that and more when we return to Ebola Global Hot Zone.
Canada has 2 mobile units now present there. We have been moving materiel to help support the battle against Ebola, and we have made resources, both financial and otherwise, available to the World Health Organization and other organizations that are operating on the ground. We will continue to work with the international community on fighting what is a pandemic of some considerable concern.
You're watching a Sun News special report, Ebola Global Hot Zone. Ottawa is doing its best to reassure Canadians that our system will be ready if an Ebola outbreak happens here. So far, no cases have been reported. But each week, at least 30 passengers arrive in Canada after making their way through Ebola hot zones in West Africa. That stat has put Canada on guard.
In the battle to keep Ebola out of Canada, frontline soldiers are being armed with infrared thermometers and questionnaires. At 6 major Canadian airports, stepped-up screening procedures to prevent Ebola from arriving here.
Travelers from the affected West African countries are identified and they are asked about their health. Our government will be taking the additional step of doing targeted temperature screenings, but we'll do whatever is necessary to protect Canadians.
While there are no direct flights to Canada from the Ebola hot zone in West Africa, Canadian public health officials are taking no chances.
Special quarantine officers and border agents are on the lookout here in Toronto and in airports in Montreal, Vancouver, Halifax, Ottawa, and Calgary. Incoming passengers are being questioned to check to see if they've traveled to the Ebola-affected region, if they feel unwell, or if they've been in contact with a sick person. Those suspects will be given a temperature test by border agents.
Our quarantine officers are trained medical practitioners, they're nurses, and they will ask further questions. They will do a temperature screen on all individuals coming through, and then they will make decisions.
And if a passenger on an inbound international flight falls ill, pilots are to radio ahead, so when the plane lands, a quarantine agent will board to assess.
So if the risk is high, if the person shows up and has a fever and gives a history of contact or said they've been in contact with Ebola or been in an Ebola hospital, they will be referred immediately to local public health authorities.
The goal? To stop anyone with possible symptoms of the deadly virus from getting past airport gates and into the general public.
I guess it's necessary.
There has to be some type of screening to make sure that the Ebola doesn't spread further.
I think it's a good idea because you don't want everybody in the country to come and get infected.
Enhanced Ebola screening happening in the U.S. as well at 5 major airports that handle the most flights from affected region in West Africa.
We're stepping up protection for people coming into this country and for Americans related to travel.
It's estimated upwards of 150 passengers arrive daily at these 5 U.S. airports from Sierra Leone, Liberia, and Guinea.
We expect to see some patients with fever, and that will cause some obvious and understandable concern at the airports.
Heightened Ebola fears already leading to surreal scenes where crews in hazmat suits boarded 2 planes. Both turned out to be false alarms. In the U.S. and Canada, new lines of defense in safeguarding North America from the further spread of Ebola. But will it be enough?
Nika Alexandra is a spokesperson for the World Health Organization. She's just back from the affected region in West Africa and saw firsthand the devastation this killer is causing. She joins us now. Nika, tell us, where were you and what was it like?
So for the month of August, I was in Guinea. In September, I was in Sierra Leone. Do you know what's really striking? It's life as usual in most of the cities. I worked in an office. I took a van with my colleagues to go to the office. I went out, went to markets and so on. It's life as usual for most people. There are some villages, there are some households where there's Ebola, and it's not life as usual for those people. For people who are sick with Ebola and need to get into a treatment center, that's not life as usual. We met people who worked in treatment centers. We met the really brave doctors and nurses who worked in treatment centers, and that really brings it home for you. But one of the things that was most striking for me is not necessarily what it was like there, but what it was like when I got back. I just felt we're so lucky to have what we have, to have the systems we have, to have the awareness we have with our governments, to have the hospitals with the amazing infection control systems they have in place already, and just the wealth that we have around us. So it's such a contrast, and yet at the same time, people here are so scared. So I hope to be able to discuss with you some things that will make people less terrified of Ebola here, but equally still concerned about Ebola in the countries that are most affected.
Well, some folks say that, you know, the fear has spread faster than the virus. But I have to say, before we talk about our own systems, you're here, you're just back from the infected area. Am I in any sort of danger? Do you go through an incubation period or anything like that?
I have not been in touch with the blood, the vomit, or the feces of somebody who's ill with Ebola. And that's basically what it comes down to. And I have to say, there were times that I was scared. There were times when, you know, when you're traveling and you eat something funny and you're feeling a little, you know, throw-uppy, and I'd think, oh my goodness, what's going on? And then I'd ask myself, have I been in touch with somebody? Have I literally touched somebody who's sick with Ebola? Have I been to a funeral and touched the body of somebody who died from Ebola? And if the answer is no, then I don't have Ebola. And you have to tell yourself that a lot when you're in those countries. I'm hoping that people here in Canada are not having to go through that exercise on a regular basis, because their chances, their risk it's just so minimal.
Now, getting back to Canada and North America more broadly, where we do now have Ebola cases, at least when it comes to the States, one U.S. hospital worker said, we are one shift away from someone else getting sick. We're hearing the same echoes happening here in Canada. The Canadian Federation of Nurses, that union, they've come out and said, we're not trained. We're left to train ourselves. You work with the WHO. Is there going to be some sort of universal effort to standardize what is needed in order to protect both the patients as well as healthcare workers?
So those standards are already in place, and what you're seeing, this kind of wall of fear, in a way, is people becoming fully aware that Ebola is out there and that we need to be vigilant for if it comes towards us. And hey, are our systems ready? Are they in place? Do they need to be tested? And that's really important, and that's exactly what WHO recommends, that people go through those exercises to see if they are in fact ready. So that's a healthy reaction.
Does WHO have any opinion on perhaps banning flights to and fro the affected areas?
I think banning flights seems at first glance like a good idea. People might think, well, we just stop the travel and that will stop it. What that will actually do is make the situation in those countries worse, therefore increasing the devastation of Ebola and increasing our own risk in the long run. People often think, well, quarantine seems like a good idea, but historically quarantines don't work. When you tell people don't move, that's when people say, I want to get out of here and I want to move. So those bans, those quarantines don't work generally. WHO, of course, lets countries make their own decisions, but their recommendation is not to have any travel bans.
Now, here in Canada, about 72% of us that were polled say that we are confident that proper precautions are in place. Do you believe that if Ebola were to touch down here in Canada, any one of our major cities tomorrow, that all of our hospitals would be equipped to handle it?
I'm not going to make a blanket statement about Canada, but I know that countries like Canada, like the US, are very aware. Their hospitals are very well resourced. They have the money to have the protective gear in hand. And as you were saying earlier, they have the wherewithal to start this training now ahead of time before it's needed, and that's really important. In West Africa, the training's happening now because there's such a shortage of healthcare workers, and especially of healthcare workers that know what to do, that countries like WHO, working with the US, with the UK, UK are doing trainings for healthcare workers to teach them all about how to put on the protective equipment and especially how to take it off in those 17 minutes of meticulous steps you have to go through so that you don't infect yourself while you're taking off the gear.
Well, I have to say, Nika, I know that you think it's a lot of hype, but I think for a lot of Canadians out there, until we can make those blanket statements, there's going to be some just cause for fear. We're going to have to leave it there. Thanks, Nika. North America is not the only place battening down the hatches against further spread of this insidious outbreak. Europe is ramping up defenses, too, to keep the killer Ebola at bay. We'll have a report from London with correspondent Simon Kent. All of that and more when we return to Ebola Global Hot Zone.
It is likely we will see a case of Ebola in the UK, and this could be a handful of cases over the next 3 months. Public Health England will start screening and monitoring UK-bound air passengers identified by the Border Force coming onto the main routes from Liberia, Sierra Leone and Guinea.
Welcome back to our Sun News special, Ebola Global Hot Zone. The menace of Ebola has people across Europe shaken and scared for their lives. More and more cases are popping up each week. Sun News contributor Simon Kent joins me now from London. Now, Simon, Europe was the very first case to be transmitted outside of Africa. What's the mood on the ground? Are people concerned about the spread of Ebola?
They're concerned, they're talking about it, and they're acting. Here in the UK, just in the past week, we've had news that border control authorities are screening passengers on arrival, and they're leaving them to self-identify, and they have to fill out their forms and questionnaires across Europe too. That précis is being followed as Europe has to come to grips with this pernicious disease. And then outside of the UK, you look at Spain more recently with a dead nurse, and then you look at Germany and the Netherlands and Italy. Across Europe, they're not panicking, they're not drowning, but they're certainly starting to wave.
Now, with respect to Spain specifically, a great case study that has a lot of parallels to what we're seeing in Dallas. Lots of blame being spread over between, is it the nurse's fault? Is it just cut costs and the rest of it? Have we learned any lessons to date? Is Europe any safer today than she was before these cases?
Faith, there's plenty of blame to go around, believe me, from healthcare workers, from travellers, from the austerity cuts that have been made in hospitals. One thing that is common right across Europe with all the identified cases so far has been the healthcare workers who have been treating patients either in West Africa or here in Europe. So if healthcare workers can't get it right, people who work in hospitals, in clinical, sterile environments are getting infected. The fear is that if this then goes into the community, then that is where the panic will start, because if it can't be confined to hospitals, what hope has any society then have of trying to keep it under control?
Now, I want to pull up a map of where the case is likely to be imported to next. Folks, what you're going to see on your screen is a radiant over here. Really high likelihood in places like UK, where you are right now, Simon. You point to perhaps a diminished faith in healthcare workers, their training, their standards. What about European leaders? Is there any faith that they're going to help you in this mess?
There is. The UK has decided to tackle this problem at its source. It sent a Royal Navy ship, the RFA Argus, is heading to Africa. Even as we speak, they're sending nurses. 800 National Health Service volunteer health workers are heading to West Africa. France is, and I think Spain is as well. They think the aim is tackle it at its source, tackle and identify people before they travel, before they get to Europe. But you do get the feeling sometimes in the community that the horse has bolted, and the feeling is, again, that if it has spread into the community, then this disease is running far out in front of anything that any hospital or any health system, not just in Europe, but anywhere in the world, can do to catch up. It's a catch-up game, and they're losing.
And it's based again on this good faith of the passenger, of the traveler, that they will fill out their form properly, admit that they have a fever and the rest of it, never mind perhaps some intentions of wanting to get to a better healthcare system. Now, we showed one map, but I also want to draw our eyes to places like India and China, because Simon, folks have said if it goes there, we could be in some seriously deep waters. What are some of the challenges if it spreads to those sorts of populations, India, China, for example?
Okay, let's look at India and China again with the modern air links, and again that's why Europe is so worried, because so many airlines coming out of Asia, India, Africa have regional hubs in Europe. So the feeling is if it becomes widespread in those densely populated areas with very poor and run-down antiquated health systems, then you go from an epidemic and a possible epidemic to a pandemic. That hasn't happened yet, but it's going to need a huge amount of cooperation between the World Health Organization and individual national state organizations in China, in India, and also the organizations, the travel companies that move people around the world. This has all got to get in place, and it's going to have to move really quickly. Again, they've got to get out in front of this, Faith.
Absolutely. All the more reason to do so, and do so quickly. Thanks, Simon. Simon Kent reporting tonight from London. Next up, we look at the heroic foot soldiers on the front lines in the war against Ebola, how health workers in the affected region are trying to contain the outbreak under brutal conditions. That's still to come when we return to Ebola Global Hot Zone.
There are a team of hygienists who will take care of the hygiene in the isolation wards, which is very important, certainly in an Ebola isolation. So we're showing them how we dress up.
Welcome back to our Sun News special, Ebola Global Hot Zone. While the world watches in terror as the virus rampages across West Africa, frontline workers are putting their lives at risk to help contain the deadly killer. Joining me now is one of those workers, JP Taschereau. He's head of the emergency operations with the International Federation of the Red Cross and Red Crescent Societies, and was in the epicenter of the outbreak in Sierra Leone and also in Guinea. He's in our Ottawa studio. Thanks very much for being here, JP. Right off the top, I got to ask you, what does treating Ebola look like?
Well, what we see is an intervention that has to happen at all levels. There's a lot of attention given to the clinical case management, but there's also a lot of work that needs to be done in the communities by educating people against the outbreak and what to do if they do become sick, by tracing people who might have come in touch with the virus or people who were infected, so that if they develop the symptoms, they do seek early medical assistance. Then there's the clinical case management itself. And finally, the last component of the work, a very important one, the grim part of it, is the management and the safe burial of the dead bodies of people who died from the disease.
Now, you in this crisis healthcare team, what are some of the risks that you face when you're out there?
Well, the primary risks are faced by the people who work in what we call the high-risk area, so the medical personnel, the hygiene personnel, the cleaning personnel, and our burial team. So these are the risks that people that come into contact every day with the virus, with people who are infected with their bodily fluids, these are the people day in, day after day, week after week, that are the most exposed. So in order to reduce as much as possible the risk to this personnel that really is putting their lives on the line, we have very strict trainings and protocols that we put in place, and a buddy system to make sure they watch over each other, and all other kinds of measures to try and minimize the risk as much as possible.
JP, I gotta say something on behalf of our viewers, because I think some people are looking at the screen and they're thinking that man is a hero, and other ones are thinking he's completely nuts. He's putting his life at risk to go out into the middle of an outbreak region. What makes you and other frontline workers tick?
Okay, first I'd like to say that I think I'm neither a real hero or completely nuts. I mean, again, I want to give tribute to the people who are the high-risk takers, the people that are on the front line, the medical workers, the people who take care of the burial teams. This being said, my work in the response is, or why I do get involved, is I think it's important that when we can do something about this, that we should. And keeping in mind that the only way to make sure that the disease does not come to Canada is to stop it from spreading further in the affected countries. So really, it's long-term thinking that makes us deploy the efforts that we're deploying on the ground right now.
And how are we handling our men and women that are going over there and coming back? Are they being put into isolation on the way back? Is it voluntary?
Yeah, it's a gradation depending on the exposure that they might have received. For example, in my case, since there was absolutely no risk of me having come into contact with bodily fluids of infected person, because I was not interacting with them directly, I was getting daily phone calls, and we have protocols with Health Canada, with Health Ottawa, and our travel health at the Red Cross to make sure that if something should develop, that we would intervene right away. Fortunately, I'm way past the incubation period now, so I know I'm in the green zone.
What can we expect going forward? Are you confident in Canadian hospitals to take care of a potential Ebola case?
I mean, if you look at what's happened over the last couple of months, there were isolated cases that appeared in Senegal and Nigeria, and those countries were able to respond quickly enough to nip it in the bud. So the longer the outbreak is going on, the farther the disease is allowed to spread, the higher the chances of one or a few cases appearing in new countries. What's really important is to wage that war on two fronts. On the home front is to be able to react quickly, isolate people who might have the symptoms so that they don't contaminate other people further. And more importantly, for the long term, is to bring that fight back to West Africa, to Guinea, Sierra Leone, and Sierra Leone, and Liberia, and reinforce our Red Cross teams that are on the ground right now and stop the virus from spreading further.
Well, JP, you might not call yourself a hero, but I have to say I'm in awe of what it is that you do and responding to that vocation. Thanks very much, JP.
Thank you. Thank you so much.
Still to come in our special broadcast, Made in Canada, the role our researchers are playing in the race to find a cure. All that and more when we return to Ebola Global Hot Zone. Welcome back. You're watching a Sun News special, Ebola Global Hot Zone. This past hour, we've shown you about the fight against this deadly killer, from the front lines to the test labs. The virus has already killed more than 4,500 people, and the predictions, well, they're grim. Sun News contributor Kevin Gaudet, he's here to talk with us about what's next. Folks at home just saw that graph, people dying by the day. There have been several mutations in even just the past 6 months. What does the Ebola of tomorrow look like? Do we know?
Well, I guess technically we don't know, but the risk of the disease changing in a way that threatens humankind in some type of science fiction type way is extremely low. So I don't think people have much to be concerned about. If we want to talk about what the future of Ebola is, we should just turn our eyes to West Africa and turn our policy goals and objectives towards how we can stamp out this disease in West Africa, where the hot zone really is.
So then what does that mean for Canada? What's our future when it comes to this deadly virus?
Well, there have been a lot of mathematical models. Scientists love to do their math, and when they do their probability calculations, there is a risk that it's going to come to Canada. We've seen a number of suspected cases already.
For sure.
So healthcare workers, of course, are duly concerned. But that risk is, mathematicians say, 15 to 20% chance that somebody's going to come to Canada with it. And if they do come, we will stamp it out more effectively than they did in Dallas. Again, what do we need to do as a nation is keep our eyes focused on West Africa and what we can do to help on the ground there to stamp it out there so it has less chance actually of leaking its way into the country.
You know, I hear people say time and time again, there's nothing to see here, there's nothing to see here. But look, it's Dallas, Texas, in the United States of America. This should be where the best medical facilities and the most stringent standards are met. And yet we have healthcare workers that are contaging Ebola after treating a man there. So, I mean, can I really say and truly believe that Canada's going to be that much better?
Well, I think so. We learned a lot from SARS. We had one of the best learning experiences from SARS than any other country did. And I'm confident that we've got protocols in place, and there's increased calls for training for our nursing staff when patients present who might be symptomatic, who are at risk of having come from disease-prone countries. Are we foolproof? Are we accident-free? Of course not. But I think we've got better protections in place than other countries do. I think Dallas is a beautiful example of where they just screwed it up, and heads should roll as a result of that.
Now, speaking of securities, because of the expanding threat of Ebola, some folks have talked about possibly quarantining people without any sort of symptoms, just that are suspect. What do you think about this? Is it worthwhile to sometimes surrender some liberties for the sake of biological security, or is that a step too far?
Well, it's interesting, actually, that they're enforcing these mandatory 21-day quarantines now, because that never used to be the World Health Organization recommended protocol for exposure. They used to just say monitor your temperature twice a day, and if you become symptomatic, immediately present yourself to a hospital. Because the research indicates that when you're not symptomatic, you're not transmittable. The disease isn't transmissible. They've changed that now so that they're forcing people, demanding people take quarantine. Canada passed a law during the SARS outbreak allowing the government to impose quarantine. The U.S. doesn't, across the country, have that law. Some states are starting to impose emergency measures so that they could enforce it where and when they choose. That does raise the important issue you raise, Faith, as to how much freedom we're willing to give up as the state decides arbitrarily to demand that you stay at home if you've come into who knows how many levels of contact with somebody who may or may not have been symptomatic.
Well, we saw with patient 0, Thomas E. Duncan, that he could have had up to 100 different contacts with various people, and one of the nurses driving her car. Thank goodness she didn't have an animal. But you work at this network. You know the stories that we cover here, including terrorists. And my worry is if these guys get their hands on Ebola, we've seen the threats on Twitter, how they could use it for biological warfare. Is this just nothing to be worried about, nothing to see here?
Well, I think these are all questions of a degree of spectrum of worry. You know, on one end, I should be really worried about somebody walking down the street and cutting my head off. There's probably a greater risk of that than some ISIS member somehow taking on Ebola and becoming a walking Ebola bomb. I think the chances of that are a heck of a lot less. So I would say it's not something we need to worry about.
Okay, now for the folks at home who just want to take extra precautions, I was in the airports yesterday. Last 30 seconds, what can we do as private citizens?
I'd say live our lives and make sure that we focus our government efforts to stamp this out in Africa so it doesn't bleed out and less risk of it jumping on planes or going through second or tertiary routes and coming into Canada indirectly.
All right, I'll be stocking up on the Purell, though, nonetheless, maybe riding to Florida in my hazmat suit. Okay, thanks so much for joining us, folks, and thank you, Kevin. This was great, and thank you for being part of this in-depth look into Ebola, the global hot zone.